When it happened, I guess the thing for me was I felt something slide, kind of like slip through, and that was a feeling. I know that a lot of people describe it as a pop, but I definitely felt it as like a sliding. So I looked down and I thought, oh, I pray to God it's my kneecap. It's just popped out. I've watched many AFL footballers just pop it straight back in, and I think I was hoping that was going to happen. And then when I looked down at it and I saw that was in place, I knew exactly what it kind of was. And I think the first thing that flashed through my head was, there goes my Netball World Cup. And then obviously for Vixens not to be able to have a go at a back-to-back premiership. Luckily when I did it, my mum and dad were actually in Perth with me, so it was really nice to have some family support there. They were my mum was more inconsolable than I was fine. I was like, this is reality, this is what it is. I go out to play sport every day, and unfortunately these risks happen. But yeah, it was nice to have them there, I think, in that moment when obviously my whole world was netball world was crashing down, and I at least had some family support there. So I pretty much flew back that night because we played on Monday in Perth. Flew back that night, had scans on the Tuesday, saw the surgeon on the Wednesday, and had surgery the following Thursday. So it was only about 10 days that I had to wait for surgery. And in that time, they say to you got to best prepare your knee for surgery. So I was obviously reducing the swelling, making sure I could move, making sure I could have as much freedom and extension and bend in it as I possibly could. And I actually wanted to go for a run. I was like, oh, can I go for a run? And I didn't in the end because I was unsure, but I was on an exercise bike and doing everything as per normal. And then obviously to have surgery, the only thing I could do was the lateral movement. So surgery is the thing that I needed for that. I was just an overnight. So I was in there at about midday, and then I had surgery at 3, and I was out at 9 a.m. the next morning. So it was pretty pain-free in the sense that I didn't have to stay long in the hospital because no one loves hospital beds. The morning after surgery, like the physio came in and did a few exercises with me, and just before my mum and dad had arrived to come and pick me up, I was actually walking the corridors with my crutches, and my mum walked in and was like, oh, what are you doing? Like, you're walking, kind of thing. So they got me up straight away, and I think that was one of the things that I got taught or told by an ex-player that had done her knee twice. She said, it's going to be painful, it's going to be really hard at times, but you've got to push through that pain because in the long run it'll pay dividends. So the second I got home, I tried to be as independent as I possibly could on the crutches to support myself, but putting pressure on it, doing my little exercises, all those types of things to make sure that I was giving it every opportunity to heal as quickly as it possibly could. So it was a typical hamstring graft, so they just do this. I've got 1, 2, 3, like the most pathetic scars. I wish I had bigger war wounds, really, because through the pain that I've gone through and what I've got, I mean, it just shows how incredible the surgeons are. But they go up, they take one of the tendons out of my hamstring. So there's 3 tendons, and they've taken one, and they replace that. And I've got a screw at the bottom and a screw at the top to screw up the ACL, to replicate the ACL in place. Usually where they attach it, they hope that some of the fragments of the ACL will eventually reattach to that one that they've joined. So when I've had my checkups, they're looking for the ligament to be as black as it possibly can, and the last couple of times it couldn't look better. So obviously, as I said, the way that it's obviously been done, I had one of the best surgeons, Julian Fella in Melbourne, so I've been very lucky with the whole process.